Today I want to talk about sciatica. This is a condition that as a physical therapist I've seen hundreds of times, sometimes misdiagnosed, sometimes properly diagnosed, but overall there's a bunch of misconceptions that relates to sciatica. Now, sciatica is a very common condition in the sense that the Cleveland Clinic states that approximately 40% of Americans will have sciatic pain type symptoms at some point in their life. So I want to talk about why that is, how you can assess for it, and what you can do about sciatic pain from a physical therapy perspective. It's important to know that conservative care, such as physical therapy, is highly effective when dealing with sciatica. There are some conditions, obviously, that warrant surgery, but in sciatica, in most cases, you're able to get away with physical therapy, exercise, lifestyle management, and it has a pretty high success rate. Now, it can take a long time. It can take months for it to go away, but conservative treatment is the ideal gold standard for sciatica. So what is sciatica? It's talking about irritation of the sciatic nerve, which is the biggest and longest nerve in your body. It runs from your L4, so your lower lumbar vertebrae, through S3, so your tailbone vertebrae. They eventually come together and form a nerve that goes down the back of your leg, through your hamstring, through your calf, all the way to the bottom of your foot. So it innervates muscles and sensation all the way down the back of your leg, into the bottom of your foot, into your toes. So when you're dealing with sciatica, it typically refers to some sort of irritation of that nerve. Now, a light irritation of that nerve, a small compression, can cause pain. So sometimes you have pain down the length of the nerves. Maybe it's just in the foot, maybe it's just in the calf, but some sort of pain means that something is compressing on the nerve. Now, tingling is the next step up from that, where there's a little more compression on the nerve and sensation is actually decreased. So that can be on and off. That can be consistent tingling, in your foot and your calf and your hamstring, where, oh, it kind of feels like it's tingling, like it fell asleep and it didn't quite wake up. The next most severe case would be numbness. So that would be, okay, the nerve is actually getting compressed in a way that signals aren't getting through, sensory signals aren't getting through. I can't feel the bottom of my foot. I can't feel my calf. That's a little more significant of a symptom. The strongest symptoms are going to be motor loss. So that's going to be, okay, I can't go up on my tiptoes now because that nerve is so compressed it's not sending signals down from my spine to my muscles telling them what to do. So I'm not able to go up my toes, I'm not able to bend my leg, I'm not able to squat, things like that. The most severe cases can cause incontinence, so that can be where innervation to the bladder and bowels can be affected. That's a severe case. That warrants, possibly surgery, definitely some strict intervention. But if we're erring on the side of, conservative care, typically tingling, sometimes with numbness, and definitely with pain, we have a high success rate with physical therapy. Now, it's important to understand that sciatica has kind of become a catch-all term when it comes to medical diagnoses. Unfortunately, especially in primary care, they're spending less and less time with patients. So what often happens is you go in, you say, doctor, I hurt my back, or I'm just feeling numbness tingling down my leg, and they're gonna say, sciatica. Maybe they'll do an x-ray just to look at, maybe there's a little compression in your low back, something like that. True sciatica can be difficult to determine because, as I've talked about before, x-rays, MRIs, when dealing with the lumbar spine, can be inconsistent. Sometimes there's been issues there before, but true sciatica involves compression of the sciatic nerve at some point along the track. So initially, that can be when it's coming out of the spine. So maybe you do have a herniated disc and the nerve is being compressed. Maybe you do have some spondylolisthesis, some stenosis, something like that, that's causing the spine to be shifted and compressing on that nerve where it's coming out. It could also be that you're catching the nerve down here in your piriformis or in your glute or something like that, where it's a tight muscle that's pushing on that nerve and that's causing symptoms down the way. So sciatica doesn't necessarily have to come from the low back. That's typically the area where the compression is that's causing the issues, but it can be a compression anywhere down the train. Now, the problem is that we have kind of, like I said, gotten lazy and started calling everything sciatica. So we do have what's called referred pain. So referred pain refers to when you have pain from somewhere in your body that's from another part of your body. So they often talk about a heart attack. You feel it in your left shoulder, you feel it in your back. It's not where your heart is, but that's where the nerves and everything run in your body. So when we're dealing with referred pain, the glute is a great example where referred pain from your glute can go all the way down your leg into your toes, where there can be a knot or a trigger point there. There can just be tightness, there can be irritation, tendonitis, something like that of the glute that can cause that pain down there. Maybe it's a hamstring issue. Maybe there's a deep hamstring strain that's causing some tingling sensation or things like that. So when we're dealing with sciatica, it's important to be as specific as possible in our diagnosis of, is it actually a sciatic nerve? What area is being affected? What area we're going to treat? Now, like I said, conservative care is very effective, but you want to find a physical therapist or someone who can give you as accurate of a diagnosis as possible. And that can take time sometimes of Okay, we're gonna go through some spinal assessments, we're gonna go through some hip assessments, some leg assessments, and try to figure out the exact cause because that's gonna give you the best treatment. So next I wanna show you a couple easy exercises that your physical therapist will probably do with you, but you can also do at home to determine if you have sciatica, why they work and what they mean. So the simplest test for sciatica that your physical therapist is going to do is called a straight leg test. So what they're going to do is they're going to lay you on the table and they're going to lift your leg as if they're stretching your hamstring. So imagine if someone was lifting my leg for me. It's important that you don't do this actively. So you're going to keep the leg straight, you're going to lift it up, and they're going to ask you when you start to feel symptoms. The clinical definition of the test is you feel symptoms between 30 and 70 degrees. So 30 degrees would be about here, 70 degrees would be about here, feeling pain somewhere in that area. What you're really looking for is a reproduction of your symptoms. So if you have tight hamstrings and you feel tightness in your hamstrings, but your typical sciatic pain is down in your foot, then that's not a positive test because it's not replicating your foot pain, it's just causing tightness in your hamstrings. So it's important to remember that. So what they're going to do is they're going to take you, bring you up here. Okay, I start to feel symptoms. Let's say it's, tingling in my calf, pain in my calf. They're then going to dorsiflex your foot, which means they're going to bring your toes back towards you. Now, if that makes your symptoms more severe, that's a positive test because it's important to remember your sciatic nerve comes from your low back, runs through the back of your hip, hamstring, calf, all the way down in your foot. So by extending like this, I'm stretching that sciatic nerve. By dorsiflexing my foot, bringing my toes toward me, I'm extending it more. So I'm putting more stress on it. So if that increases your symptoms, it's because we're stressing the nerve more and irritating it. If that doesn't increase your symptoms, then that's not a true positive. That might not be the sciatic nerve. That could be a tight muscle. That could be a strain, something else that we're dealing with. I want to show you one other test that's the slump test that's very similar and easy to perform on your own. The next test that I want to talk about in looking at sciatic pain is the slump test. Now this is much easier to do on your own, but your physical therapist will probably do it with you as well. So you're going to be sitting, you're going to slump down like you have terrible posture, try to round your back, especially through your low back, and you're going to straighten your leg out. This is the symptomatic leg, this is one that's bothering me. Now I want to go until I start to feel my symptoms. So if I feel numbness and tingling in the calf, typically I want to go until I feel that. Once I feel those symptoms, I'm going to straighten up with good posture. If my symptoms go away, that's a positive test because what we're doing is we're tensing the sciatic nerve when we're slumped down because as we talked about, it comes from the low back down through here. When I sit up, that should put some slack on the nerve. It should be less irritated by doing that. So if it is out like this, slumped down, and it's painful, or it reproduces your symptoms, and you straighten up and that goes away, that's a positive test. If you straighten up and it doesn't go away, then you probably have an issue somewhere else. It's not true sciatica. When we're dealing with sciatica, as I mentioned before, conservative care is very, very effective, including physical therapy. So the first thing that we want to talk about is decreasing the pain and tenderness in the muscles along the whole track of the nerve. Because even if your compression is in your low back, you might have tightness in your hips, you might have tightness in your hamstring, your calf, things like that, because that nerve is irritated and the nerve innervates all of those areas. So manual therapy, stretching, massage, dry needling, things like that are very efficient for that. But if you're on your own and want something, a foam roller is a great place to start. Now, often the glute piriformis area can be a huge area of tension and pain and tightness in the nerves. So that's a good area to focus on. Now, with all of this, we don't want to do aggressive stretching initially because typically that's going to cause more pain or irritation. So just aggressively going into a figure 4 stretch can actually make things worse because think about this muscle might already be stretched tight. That nerve is already stretched and taut and then you're just hammering this. It can actually feel better short term but make things worse long term. So things like manual massage therapy, foam roller can be helpful because you're not changing the length of the muscle, but you're still getting some relief in there. So if I'm working on my right hip, just going on the foam roller, sitting here kind of a quarter turn. So I'm not all the way to the side, I'm not all the way straight up, I'm kind of quarter turned, rolling through here in that hip muscle kind of between the head of my femur and my sacrum, my tailbone. So right in there, there's a lot of muscle there, your glutes, your piriformis, a bunch of little muscles there. If this is super easy and we're not feeling very irritated, then we can try doing a little bit of a figure 4 type thing, but that's usually going to be more as you're starting to heal or if it's a very mild case of sciatica because that's going to expose that piriformis muscle and make the rolling more effective. But like I said, it can put stress in there, which can irritate things more. So gentle stretching can be helpful, very gentle, some sort of myofascial release with a massage roller, something like that can be helpful, as well as, importantly, manual therapy from a therapist. Now let's talk about some exercises that you can do for strengthening and mobility. So when we're talking about exercises for sciatica, we want to be as specific as possible, and we generally want to start as light as possible depending on your symptoms. So as I mentioned before, the hip glute piriformis area is often an area of weakness, pain, and it's important to get that area moving. Now, if you just have calf issues, you can work on calf raises, things like that, but typically most clients I see are going to benefit from some hip targeted work. So the easiest exercise is a clamshell. Now, I've talked before about I don't love clamshells. I think they're a very easy, simple exercise. But if you're in pain and you just need to get things moving, because we're really not looking at strengthening at this point, we're more just mobilizing the muscle, getting the blood flowing, getting it moving, then this is a great exercise to start with. So we're going to be laying on our side here. And you can do it without a band if you're super painful. If you're a little less irritated, you can put a band around your knees. And we're just going to be here relaxed and just separating here, keeping the feet together, bringing the knee up as far as we can without rolling our back too much to let that happen. Now we're going to do it on both sides because obviously we want to be moving both sides because those muscles are pulling on the sacrum and everything in different areas. So even if I'm only having symptoms on one side, I want to do the other side as well. Now, if that becomes easy, we can start doing a more aggressive isometric type exercise like a side plank. So we're going to come up on our elbow and our knees here, and we're just going to come up through here and brace through there for about 10 seconds. So with this, I'm using the down leg more to stabilize myself through here, but it's a heavier isometric where I'm resisting my body weight and stopping myself from moving. Now, if that's easy, you can straighten the legs out. You can try to combine both where we're doing a side plank up here and we're doing a clamshell through there, maybe with a band around. There's a lot of ways you can scale this to strengthen those muscles in the side of the hip and more importantly, just activate them, get the blood flow and get them moving. Now, if we're looking at those muscles, but also the hamstring and calf, an easy exercise to do is a bridge. So there's a lot of misconceptions around bridges in the sense that they should just be glute exercises. That is not true. They're fantastic hamstring exercises when done correctly. So if we're coming through here, I want to make sure my weight is even through my feet, so from my toes all the way through to my heels, and I'm just lifting my hips up as far as I can. Now this is a pretty easy exercise, but if you're irritated, it's going to be a hard one. So we should feel it in our glutes, we should feel it in our hamstrings, maybe a little bit in our calves. We should all feel those activating because those are all innervated by the sciatic nerve. So we're just working on going up and holding. If that's easy, maybe we go to one leg. We just do what we can there. Now, if those are all super easy, an exercise I love is a bridge on a foam roller. So I'm putting the foam roller down here. I'm putting the balls of my feet on the foam roller. I'm keeping my heels up so they're level. I don't want them down here sinking down. And I'm just lifting up from here and holding. You're gonna go up as high as you're comfortable and hold. You should feel this a lot more in your hamstrings. That's a good thing. If you start to feel some cramping, some twitching, anything like that, you're in the right area because your hamstrings are probably undertrained. That's part of the weakness of your sciatica, so it's a great area to target. So those are some simple exercises on the table or in bed that you can try. Let's talk about some standing exercises that can be even more effective as you start to feel better. Some standing exercises that I like for sciatica, they're a little more aggressive about strengthening. So if you have low symptoms or your symptoms start to resolve and you want to start getting a little more aggressive, these are great places to start. So hip abduction is the strengthening of the muscles on the side of the hip, so the piriformis, the glutes, things like that. You can use any sort of machine at the gym that's similar, but if you don't have a machine, you can just hold on, have a band around your ankles, and just be going out to the side. I'm staying up nice and tall. I'm keeping the leg straight that's coming out here. I'm not letting my toes turn in or out, and I'm just going out there, and I would do the same thing to the other direction. This is the easiest way to strengthen those muscles. That's the most targeted. You can try stepping sideways. You can do other movements like that. But I really just like simple standing and moving out to the side because you're going to feel it in those hip muscles. They're going to get strong pretty quick. Now, another exercise I love for sciatica is a deadlift. This is once you're feeling good. It's a great way to load the whole posterior chain. So your low back, glutes, hamstrings, calves, everything. Now the bridges were a great way to start, but we're not really targeting the low back when we do that. So as we start to feel better, we definitely want to get the low back stronger so it starts feeling better, get the blood flowing there, but also prevent this from happening again. So building strength in the low back is crucial. So we're taking a bar here. If we're deadlifting, you can use dumbbells, whatever you're comfortable with, starting with bending the knees a little bit, and then we're just thinking about staying nice and straight, all the way down, all the way up, just as far as we're comfortable. And as that starts to get easier, we can go down even further. We can do what we feel comfortable with. Talked about it before, deadlifts are an exercise that everyone is scared of, especially those who've had low back pain, sciatica, things like that. Is the best exercise to get back to because it's the best way to strengthen your back to prevent something from happening again and to gain more confidence with day-to-day exercises. So there are a bunch of exercises that you can do in between. These are just some highlights of what I like to do with my clients. That sums up a lot of things that I think about sciatica. Gives you some good ideas of what sciatica actually is, how to assess it, and how to treat it. Now, just take home message, as I said, Conservative care is very effective for sciatica, but it can take months. So that's the hard thing for people to understand and deal with, and I completely understand. If I was dealing with tingling in my leg, pain, things like that, I would want resolution quickly. It can come quickly with sciatica, but sometimes it can also take months to feel better. I've had patients where, and this is usually false sciatica, oh, we do a little bit of dry needling in the glute, give some exercises, oh my goodness, I feel 80% better, this is so much better. I've had other ones that's taken months and you're slowly but surely chipping away. It's a very frustrating process, but unfortunately, it is the best option that we have. As I mentioned, the Cleveland Clinic shows that 40% of people in America will get sciatica at some point in your life. It's not a strange thing to get. You didn't do anything wrong to get it. It's just part of the human condition. With physical therapy, we have great outcomes in treating it. So if you're in the Sterling, Virginia area, reach out for Eclipse Wellness. Otherwise, I hope this video helped you. If you have any questions, leave them in the comments below and share this video with anyone that you know that's dealing with sciatica or has any questions about it. Thanks for watching.